Hey everybody, my name is Madisen Barwick, and today I'm going to take a few moments to explain to you about medication errors, which is taught in the Nursing 330 Law and Ethics for Healthcare Professionals course in the University of Mount Olive's RN to BSN degree program. This video is an assignment for my Master of Science in Nursing degree program at the University of Mount Olive. I have 3 objectives I would like for us to reach today. Identify medication errors, identify ways to prevent medication errors, and identify the 5 rights of medication administration. Let's do a quick overview of medication errors and how they can be prevented. A medication error is when one or more preventable mistakes are made during prescription, transcription, dispensing, and administration of a medication. A medication error can lead to inappropriate or unsafe medication use. Administration of a medication is the last step in the medication administration process. Nurses spend about 40% of their time administering medications to patients. That makes nurses are key players in detecting, recording, and reporting medication-related events. Nurses need to have a solid foundation of medication-related knowledge so that they can determine the correct or incorrect prescribing and administration of medications. Nurses are the last safety net for patients. When I first started my career as a nurse, I had a fellow nurse who had been in the profession for many years come to me and say her one piece of advice to me was to always trust my instinct. She said anytime she ever felt like something was wrong or something was off, most of the time she was right. One day she was standing at a patient's door and she felt like something just wasn't right, and she realized she had a different patient's medications in her hands that she was about to give to the wrong patient. So if you ever feel like something's not right, trust your instinct. If you're second guessing, go back and double check everything to be sure you have done everything the way you're supposed to and that you're about to do the right steps for the patient. There are 5 rights to medication administration: right patient, right drug, right route, right time, and right dose. Right patient. Be sure the patient is the correct patient to receive that medication. Ask the patient to say their full name and date of birth. If they are nonverbal, get the wristband and look and verify to be sure that's their name and date of birth. Right drug. Ensure the medication matches the drug name prescribed. Some medication can look very similar, have similar spellings, or similar names. Be sure that the medication you have is the right one. Ask the patient about their allergies or verify their allergies in the chart to be sure there's no contraindications for the patient to receive that medication. Right route. Be sure the medication is going to be administered the correct route. Some routes include oral, intravenous, intramuscular, topical, or subcutaneous. Be sure the route is appropriate for the order and the medication. Right time. Giving medications at the time they are supposed to be given is super important. Medications have half-life, so whenever they're prescribed at certain times, there's a reason. Nurses should not be more than half an hour off of administration time. This helps ensure that medications are given at their intended times when they are given in those windows. Right dose. Be sure the dose of the medication is appropriate for the patient. The incorrect dose, incorrect conversions, or incorrect concentration can have severe consequences for the patients. Think about an adult patient versus a pediatric patient. There's going to be some differences in how things are done. So just always think about your patient when you're going to do something. If you have a question about a medication, call the pharmacy. Call the provider or ask your charge nurse. There's no question that's too small or too silly. Always ask if you're unsure about something. Nurses make all the difference to patients in so many ways, but preventing medication errors is an important one. When I was in nursing school, I would use Pinterest to find some helpful tips or information about what we were going over in class. I found this acronym for medication administration, TRAMP. T for time, R for route, A for amount, M for medication, and P for patient. Time. Check the time the medicine should be given and the time it was last given. R. Route. Check the order and verify that is appropriate for the patient and the medication. A for amount. Check the order and verify that is the correct dose. It's always good to do your own calculations behind the provider. M for medication. Verify you have the correct medication and that it matches the order. P for patient. Verify it's the correct patient by getting them to say their name and date of birth or by checking their wristband. Maybe this acronym will be helpful to you as you go into the clinical setting and into your nursing profession. We need to do all we can to help keep patients safe. Medication errors are preventable. The brief overview today met the objectives of identifying medication errors, identifying ways to prevent medication errors, and identifying the 5 rights of medication administration. Thank you all for your time today. I hope you learned something that will be helpful to you in the future. Please complete the survey on SurveyMonkey and get it turned back in to Dr. Kiefer. Today, for my up-to-date information, I use Pinterest, I use Hansen and Haddad's 2022 Nursing Rights of Medication Administration and Stat Pearls, and I also use Marvanova and Hinkle's 2018 Collaborating on Medication Errors in Nursing in the Clinical Teacher. Thank you all so much.